Hi, everybody. John Fisher is my name. I'm in the philosophy department at UC Riverside, and welcome to another of our series of conversations, life, death, and everything after. We've been excited to have many interesting guests, and tonight we'll again have a really fascinating program, focusing not so much on the basic science pertaining to longevity, and anti-aging, but more practical things we can all do as we approach older age. So that's our focus tonight. And we have lots of resources that are available, background information that Maggie is posting on the chat, information, background on our guests tonight, and also resources for you to look at. Just coincidentally today, front page of the New York Times, the online edition, an article about, or an interview with Peter Attia, who writes about and does research on longevity, practices longevity medicine. And he has an interesting podcast, an interesting book that just came out with all sorts of practical ideas. Longevity medicine, anti-aging, much in the news. It's of great interest now because there really are some exciting developments in the science and also in the practical application. So we're here to discuss this tonight. Our two guests are first Dr. Asma Jaffrey, who's chair of the Department of Family Medicine here at the University of California, Riverside Medical School, and David Lowe, who's a distinguished professor of biomedical sciences here at UCR. What we'll do, here's the flow or the plan. Each of our two conversational guests will take about 8 to 10 minutes to offer a few thoughts coming from their research or their practice. And then I will moderate about a 10-minute discussion. So that will be a half hour, 35 minutes, and then we'll open it up to Q&A with the audience for a free-flowing discussion, nothing off limits. And also, if you have questions that come up during the presentations, please just put them in the chat. Put them in the chat and we'll get to them. I'm sure there is something I should be saying, but I don't now remember it. So let's just get going and welcome. I'm really happy that everyone is here. So I'm going to start by introducing our first guest, Dr. Asma Jaffrey. Oh, Dr. Asma Jaffrey.
Thank you, John. I thought I would share some thoughts relating to aging with my slide presentation alongside, so kind of keep us all on track. I'm a geriatrician, so my perspective is more related to the practical aspects of aging. So we will move on the slide. Next slide, please. So I think in terms of successful aging, I think the philosophy behind successful aging is that you have to be consciously making decisions and changing and accommodating multiple environmental and other stressors that come into play, some physical, some environmental, some psychological. And there's this model we use, in describing some of the issues that we have to confront, and we call it the SOC model of successful aging. And basically, it is selection, optimization, and compensation. Selection is when we have a limited time frame and we have multiple levels of activities we are going to perform or do an activity for which we are going to get the most return. So as we age, we become a lot more selective in what choices we have in terms of our travel, our work, and also our leisure activities. We prioritize those in that order, being the limited time frame. And then optimization is we definitely use tools and resources for optimizing our own goals. And there's plenty of them out there. Some we gauge by talking to others, some by reading books, and some by, conversations like tonight. And compensation is where, there is definitely a decline that starts, in our physiological body functions. And the earliest actually body organ function decline is in our hearing. The most acuity for hearing is acquired at age 10. And then from there on, hearing does continue to decline. Some things like brain growth does occur up to the 20s, and then it's kind of a gradual decline. So every organ system in our body has relatively some program for which they decline, and the challenge is to keep that program from setting in early and continuing to task the decline to later and later in life. Next slide, please. So I think I'm going to just cover 3 areas relating to aging. One, which is very commonly talked about, is dementia. And people worry about either having dementia or family members having dementia. And exercise and the role of exercise and physical functioning optimization is key. And then some of the social and psychological factors that gain more importance as we grow older. So next slide, please. So, people ask, oh, did your doctor diagnose the type of dementia you have? And a lot of times it may become irrelevant at some point in the dementia process to know exactly what kind it is, because a lot of interventions have to be incorporated early on in terms of doing things to reverse or prevent the decline in dementia. Alzheimer's is the most prevalent. After that, it's multi-infarct, which is more related to our societal factors of hypertension, diabetes, poor diet, other things that come into play with disease processes. Lewy body is kind of similar to Parkinson's, except it's a different kind of dementia. And it progresses rather rapidly compared to Alzheimer's. The average duration is from it's coded as between 3 years and 20 years, and most people fall in the 8 to 10 year range. And the frontotemporal is a specific kind of, frontal and temporal lobes are involved, and it's usually occurs to younger, meaning less than 60 or 60-year-old, and has a very distinct progression and distinct symptoms related to language and other areas, as opposed to the other dementias that mainly present early on as memory problems. Next slide, please. Alzheimer, which is the most common, it's pretty much over 50% of cases of dementia are Alzheimer's. So there is genetic predisposition in that there are some, genetic variants. If you have those, that you're at high risk, especially if it's a family history of Alzheimer's. It is one where you can't pinpoint when the problem started. It is progressive, but usually slowly, and it's very subtle. As I said, anywhere from duration 8 to 10 years. Some medications help in the cognitive decline in the early parts of dementia in the first few years, and keeping people more independent and more ability to do more functions. And then pretty much uniformly, all Alzheimer's will at point become progressive and disabling with time. And interestingly, the part that's interesting is when we start as from a newborn to a toddler, there's steps involved in terms of feeding, bowel training, walking, then, running and things like that. And in Alzheimer's, the changes occur opposite to that in terms of losing your ability to walk first, then losing control of your bowel and bladder. And the last thing to go is feeding, self-feeding, which is pretty much the end of dementia. Next slide, please. So the goal for the most part is not just live longer, because you have to look at the quality of life for the life when it's a limited lifespan for older people. And ideally, you want to prevent as much disability and push it to the end of life and have a very limited time where you're totally disabled. Next slide, please. So some of the physical things that happen that actually complicate things like dementia and all of the functions is loss of hearing, which actually is a big factor in terms of social isolation, unable to hear, comprehend, or hearing different things, or people talking about you when you can understand. Vision, which for the most part, if it's cataracts, it is reversible with surgery. Driving becomes a challenge, especially when there's less light around, and usually in the dark. Glare becomes more important, and inability to see in the dark is a problem. Mobility and muscle changes, for the most part, these are things that we can actually maintain well into older age if we continue to use our muscles to the maximal function, and with the help of maybe even therapy and some exercise techniques. The interesting thing is, when we're younger, our cognitive function is kind of separated from our physical function, our brain development, growth. You can be laying in bed and have still full cognitive function. As we get older, our physical functioning gets tied to our cognitive functioning more closely. So it's almost like, if you're declining physically, you're going to decline cognitively. If you're declining cognitively, you're going to decline physically. As I mentioned, a lot of preventive exercises are important, and just maintaining function, which is mobility. We have our legs and our feet, and they have a function, and that's to walk. Unfortunately, we because of our societal conveniences and catching up on more rides, not being able to walk or ride a bicycle, which would be the preferred method for getting exercise. And there are assistive devices if you do lose mobility, and they will maintain your function to a great degree. Next slide, please. So the psychological, social memory lapses are common, and there is distinction needs to be made between brief memory lapses, or what we call brief forgetfulness of elderly, which is a self-limited and normal part of aging, as opposed to memory decline that gets worse and worse. And then before memory decline, you have other higher level functions decline too, like judgment and processing. Retirement is a big factor, and sometimes, and this is specific more to males, and it may be your societal roles in society. Males adapt poorly to retirement, and females kind of have a much smoother time with the retirement. And maybe it has to do with the population that's aging and their roles in society being, nurturing and caring, and, maybe not so much in the workforce. But if your whole life is tied to your work, then after retirement, there's loss of identity, and that means a big thing to not have any self-identity. Socialization turns a very important role, and it's not so much how many, these days, I guess there's chat friends and Facebook and so many other ways of communication. It's meaningful relations with friends and family. So that becomes more important for elderly. So they may not care for, parties or, gatherings, as opposed to one-on-one relationship, or going in a small group, or traveling, things like that. Collaborative cognition is a function of when you can't hold things in your head and function well, you're going to give some of your cognitive functions or tasks to your close social contacts. So I've seen it very commonly. The daughter will take care of some things, the son will take care of some things, a third friend may be taking care of other elements. So their life still is balanced with activities and follow-throughs. And faith and religion becomes more important. And it's interesting, there's a lot of studies on a relationship of faith and religion and health. And people who are church going, regular, have spiritual faiths, tend to live longer and also recover faster from setbacks in health. So I think that attains a higher level draw or goal is to connect with whichever faith or spirituality you have, and that becomes more important. Next slide, please. And then 1 minute on caregiving. I think caregiving is the most difficult task in this day and age for your elderly friends or relatives. Sometimes you get hired caregivers, hired help. We have family devoting special time. And interestingly, as you age, it's going to be pretty much, who your caregivers are. That's going to determine your quality of life. And in general, rule of thumb is if you have a caregiver within 50 miles radius from where you are, you're going to have a better quality of life than if they're far away. And I've seen families move, or sometimes elderly people moved closer to be with families. Depends a lot on, their situations. Caregiver have the highest risk for depression and burnout. So that's something we pay attention to. There's a lot of resources available through the Department of Aging. And the one thing with caregiving and dementia is that it's not easy task. We just have to remember that this person is not intentionally being mean to you or shouting or yelling or, thinking you're taking away their money or, and it's they're accused, sometimes their own family members, of stealing things and stuff. These are all hallucinations and delusions. So you have to remind yourself, no, this is not the same parent I had. This is their problem I'm dealing with, and I need to disregard that and still maintain your relationship. And important to maintain the support systems. And I think I'll stop at that. Thank you.
Thank you so much. And we'll just go right to David Lowe, Distinguished Professor of Biomedical Sciences at UC Riverside.
Thank you. Glad everybody could join this evening. So I'll give a slightly different, more of a biomedical perspective on these questions. A while back, I was asked to put together a presentation on why, as you get older, the immune system doesn't seem to be as robust. And that really set the stage for a number of other thoughts I put together on this question. So when we talk about longevity and anti-aging and things like that, often a lot of that focus is on things like sort of being forever young, in the sense that, biochemical or, internal organ functions might be sustained for a lot longer. But what I'm going to talk about actually is that there are other ways in which the body can be described as aging, but in fact, I like to use the term maturation. So I'll give you an example of how I would look at this question. So when you are a young child, your immune system is innocent. It doesn't know the environment around it. And so the immune system has basically an untapped reservoir and repertoire that is potentially able to recognize and respond to a whole universe of insults and antigens and infectious diseases and things like that. As your immune system is exposed to infections throughout life, it remembers those. And that is important in how the immune system becomes more efficient at responding to those infections and antigens that it encounters during life. And so that maturation, rather than aging, is something that as you get into much later in life, your immune system basically has most of the immune experiences that it needs. And so it has a very efficient way of quickly responding with its memory to those repeated stimuli. Our brain is similar in that, again, as a very young child, our nervous system has, many trillions of potential connections, but most of them it doesn't need. And as you grow up and experience things and develop memories, develop skills, and all these various aspects of maturing your nervous system, you start to develop much clearer and stronger connections in your nervous system. Your memories become more solidified and stronger, so that, again, even in your brain, as you mature rather than age, that your skill sets you're much more efficient at, say, depending on the job you have, you're much more skilled at answering various kinds of questions or performing certain tasks or remembering the critical things. And that as you mature, you're no longer having to learn as many things because you have a mature and experienced and highly skilled nervous system. So then when I think when I look at a way of thinking about aging, it is not just staying young and innocent. It's actually recognizing the maturation of your biology and recognizing the maturation of your cognitive system, your immune system, all of those things that are part of maturing. And whether you want to call it aging, that's fine, but that maturation process. So then the aspect Dr. Joffrey talked about of the decline in function, decline in things are also, yes, part of the biological process as well. So then how do we kind of like take those two together? Human societies have given us kind of a conventional set of pathways that we go on. So as a young person, we think we're going to be young forever. We're going to acquire skills. We're going to develop a career. We have the idea that we're going to, accomplish a million things, and that we build a legacy, or we build a whole career. We build a pile of resources. We build families, things like that. Yet at some point later on, and unfortunately in many cases, when we're really at the peak of our neurological and cognitive skill set, we're being asked to do something called retire. And so that means that we then have to change our focus into thinking that things are continue to grow and expand, to settling into a different type of life setting. And despite the fact that we are now a fully mature immune and nervous system with the way I would describe it is the familiar phrase is like, I like what I know and I know what I like. So we are all prepared to do these things, but yet we're now having to think about changing our lifestyle and situation. And so when I think of aging and longevity, all of what I've talked about up to this point is really a question of managing this transition from when everything is forever growing and in terms of skills and abilities and all of these connections, to now consolidating those and moving into a situation is like, what do we now do? Is it a question of like, I've now accumulated enough resources that I deserve to retire, or I have built that legacy and it's time to look back? Is it time to enjoy that, all those things that I meant to do but never got around to when I was working so hard, or things like that? Is it time to look back and see, look, the family that I've built, or things like that, the network, things like that? It's that kind of question of transitioning into how you then manage that time, given all of the things that you've developed in yourself over that period. And so the way we then change our focus, change our setting, manage and transition and change what we had as our values as we grew up and matured versus now, what are those values that we've established and developed, and how are they changed in terms of our life focus? And so I guess I would kind of end it on that point, is that, again, if it's about managing transitions, recognizing that biology is sort of a one-directional thing. It's always constantly developing and maturing, but it also helps us appreciate our motivations and our values in different ways. And how do we manage that as we then make that transition into the period when we might not have the same kinds of physical capabilities, or some of the other cognitive issues or other physical issues start to intervene. But it does, again, it's a kind of question of how we view those in that context of all these kinds of transitions. So I guess I'll stop there and maybe let John take over.
Well, thank you so much. I'll take the liberty of asking a few questions. I'm just following up on that. What you said, David, suggests to me that maybe we should push retirement off as much as possible. Is that the way you feel about it?
Well, it's funny because I absolutely would say yes, that is absolutely true. Because, like I said, I feel that often people at the peak of their intellectual skill set are being asked to retire. Now, of course, if you have a career in physical labor, that age of retirement is a different consideration, right? Because the body does break down. So the age of retirement is going to depend on a lot of things. And if we're going to go into our health disparities and social equity issue, then it does matter what level of economic resources you have. Where if you did have a career of physical labor, I'm not suggesting that kind of delaying retirement, but as I said, for those who basically would find themselves in, as Dr. Jaffrey was saying, like men, had this one thing in mind for most of their lives, and they have a difficulty adjusting. It's like, let's change that, the way we approach that question, so that if the adjustment isn't just suddenly, what do I do with myself? It's like, how do I understand that transition at that later point that is a little bit more of their choosing, and allowing them more to recognize, well, now I'm going to shift my focus. How am I going to evaluate and value things slightly differently, making that, maybe helping that transition a little bit more.
Do you have suggestions for how to do that, how to make the transition? Because, for instance, I'm in a field where I'm quite specialized, and I've thought about a narrow range of philosophical issues. And you know how they say, as you get farther along in academics, you know more and more about less and less. But I enjoy it tremendously. It's passionate and it's part of my identity. What would you recommend? How am I supposed to wind that down?
A lot of people find ways to turn that around and say, this is all the stuff I know. How do you pass it along to other generations, right? And that's not easy, because you have to identify a receptive audience, and I agree. I know a lot about more arcane subjects, but not everybody wants to know what I know. And so that I can appreciate that challenge, and maybe I've seen that, like my father lived till he was 96, but he essentially had 3 careers, because later he became a political activist and community organizer, and he was basically taking his life experience and transmitting the kind of privilege and access that he had early in life, and turning it around and finding a way to transition into finding something rewarding for him, using the skills that he had developed early on, but in a different world.
Right. That's great. That's the way you put it. I like it. It's using those skills in a different context.
Right.
Yeah. Ozma, I you can jump in on or follow up on anything that just got said, but I have a question that many people probably have. A simple question: how do you know, as you're getting older, whether your memory lapses are normal cognitive, age appropriate cognitive decline? How do you distinguish that from dementia? I mean, because I'll be walking, I'll say, I'm going to get something from the kitchen, and I'll walk over to the kitchen, and then by the time I get there, I'll say, what was I looking for? Or I'll drive over to the shopping center, and for a minute there, I have to ask myself, hey, why was I driving? Of course, I realize right away, and I can still do my lectures, but how do you know?
I think the main thing, main distinguishing characteristic between the normal memory lapses of aging versus, maybe an early onset or early dementia or Alzheimer's is the fact that you're still able to maintain your functions in terms of whether it's your occupation, your social functions. You will not forget the important things, or you will keep a note, start keeping notes, which is not, even younger people do that, because when there's so much in this world these days of distractions and everything, you have to kind of come and put some things that are important and just maintain those. So if you forget, that the less relevant things like, leave your garage door open one day, forget to close it as you drive off to your work, things like that, I think those are just considered within the normal realm. The important thing would be to ask others around you if they think there's an issue or if they have similar, because I get reassured when others tell me, oh yeah, I do that all the time, So I think that's one way to check is with your peers or your spouse or partners and ask, am I off or not? But other than that, unless you would want a formal, medical evaluation, which you could do if there's concerns of that nature, but it's usually not worth it, And the other thing, most important distinguishing factor with Alzheimer's versus the benign forgetfulness of the elderly is that people with Alzheimer's will not, they lose insight alongside the memory, so they will not be aware that they have lost memory. And when you ask them questions about, do you have problems, or they will not know that they have problems. It's the others around them that notice. So that's the main distinguishing thing. If you yourself are noticing the problem, you probably don't have the problem. But if your family is discussing it around you, then there is a problem.
I don't think I'm going to rely on my wife in this regard, maybe my friends, but here's another question that came up in your discussion was the role of faith and religion in longevity. Tell me a little bit more about this, because I assume that it could be just a spiritual practice. It doesn't have to be a specific.
No, it doesn't have to be specific, organized faith or religion. It is the spirituality of what you believe in, and you get closer to that as you get older and hold on to that as being an integral part of your value system. And so I think going to church, regular churchgoers live longer than non-churchgoers. So I think the part that explains that more is the social connections related to the activities related to your faith. Yeah. So I think a lot of it has to do with your connectedness to someone else in the community is important. But I think spirituality by itself is important key and element. And it's interesting that there've been studies done even on ICU patients where they didn't know people were praying for them, but they got better faster or better healed better compared to the ones that were not being prayed for. So there's this abstract level of science related to prayer and healing that, you know, in the medical realm, it's hard to explain that, but there is some connectedness there. Yeah.
Here's a question from Mark Maharaj. What aspect of spirituality helps exactly? Can philosophy and a secular community be a substitute?
I think a lot depends on your individual and personal self, and it's the way I look at it is spirituality and faith is so personal for each person, and so if they feel connected to their secular connected community, they would have this, it would be similar to a person who feels connected to someone else because of their faith. So I think there's that element of connectedness to other humans, and that seems to be the main theme around this faith and health and stuff like that. And interestingly, I've noticed that as people get older, they do tend to think about beyond themselves about others that they're living in this world. So I think the general humanitarian kind of approach seems like, and definitely wisdom comes along that with that too. You know, they're very practical. Problem solving is excellent, you know, compared to younger people that make mistakes. Yeah.
So the importance of empathy and community could be fostered in a secular.
Yes,
Secular
it can
government.
definitely be, and it could be as good as providing the support system as another person who may find it with their faith or church. Yeah.
So I'm going to keep asking a few questions, but please, among those who are with us in the audience, please put your questions in the chat. We're open for questions. We'll go till about 10 after 7 at the latest. That's the latest. So please ask us whatever questions you'd like. For Ozma, what are the best ways, if there are ways, to avoid or push back dementia? Is it, are there any supplements? Are there any medications you'd recommend? What would you recommend for someone who does not have dementia but wants to?
Kind of avoid getting
Yeah.
dementia. I think there are protective factors, what we call some protective factors. Number one is education. So the higher the level of education, the lower the risk of dementia. So that's one thing you can tell everyone. You know, just keep educating yourself, and it doesn't have to be formal, but educating and learning, you know, like David was mentioning, you know, brain activity and connections get stronger each time you learn new skills. So education, avoiding head injuries, because I know that's a factor with a risk factor for dementia is significant head injury. So that
You're not recommending boxing?
pardon?
You're not recommending taking up boxing?
No boxing, no contact sports as far as I'm concerned, no concussions, because there's a lot out there that we have to still study relating to what happens. And then the others, the only vitamin I know is vitamin E there is, but they recommend not taking very high doses. So there is some suggestion for that. Ginkgo biloba, no evidence for that. People use, you know, memory enhancers, herbal medicines. Rather than that, I would say just go out and walk, you know, 20 minutes every day. That's going to do a lot for your brain than anything else as far as the cognitive functioning. And then there are medications that there are prescribed medications if you're diagnosed early on that can be used, but they are not recommended as preventive medications. Therefore, enhancing your function once you're diagnosed. So I think main thing is diet. You know, as healthy as possible, keep your cholesterol as healthy as possible, you know, blood pressure in the normal range. Those are significant factors for what we call multi-infarct dementia. And now we're finding a lot of patients with Alzheimer's have both. when they get their autopsies done, they have dementia Alzheimer's findings and multi-infarct together. So it's the lifestyle factor that does come into play in terms of your cognitive decline. Diabetes, high blood pressure, cholesterol are the main ones.
I think it's interesting that social connections and networks play such an important role. You see that in faith and so forth. Is there's a correlation there, but do you know what the causation is? Is there some biochemical change that takes place in us when we're with our friends, or
There does seem to be, I recently read studies on, not studies, but, in journals about brain scans for grandmothers when they are with their grandkids. They light up more when they are with the grandkids as opposed to when they're with their own kids. So there's definitely some nurturing and cognitive enhancement and pleasure that happens, and brain, as you said, their connections, emotional connections get stronger. And so I think there definitely is a role for close relationships that are maintained or enhanced, that will provide for some, cognitive abilities. The number one cause for health problems, is loneliness in the elderly. So, and loneliness can occur even when you're around people. So that's the factor we have to separate, just, loneliness from, not just having people around you, but connectedness to others around you.
So here's
maybe I can add,
David, go ahead,
some of the
David.
biomedical parts. I want to amplify what Dr. Joffrey was saying about in neuroscience, the cardiovascular health is really important. So exercise, keeping your heart, getting exercise with your heart rate up, because the vascular flow to the brain is really critically important, maintaining brain health and function. You mentioned the potential benefits of social behavior. They're actually, oxytocin, for example, there are other hormonal benefits that get triggered from social interactions. They are improved, they're part of bonding behavior. So there's real actual biological evidence for a lot of these things that she's been describing in terms of how they really benefit longer lasting cognitive health and things like that. But by the way, jellyfish extracts do not have benefits.
Oh,
Yeah,
just putting that one out there. But
I've heard that commercial and I thought it was very odd.
Yeah.
Well, this is all incredibly interesting, and I have a question from the chat, which I think it probes this a little further. The question's from Jim. He asks, can Facebook friends be a substitute for hands-on social relationships? And it kind of nowadays we're seeing that people have relationships with bots or with artificial intelligence. They go to therapists who are bots. How do you think about that? Because when I think about it as a human being and a philosopher, I think there is a sense in which you could still get those chemicals flowing just by relating to artificial intelligence. On the other hand, we want it to be real. We don't want to be diluted. So how do you think about that?
David, do you want to?
Yeah. So one of the things that's again, from a biomedical point of view, what's pretty well established is things like the bonding that people have with dogs, for example. Dogs have been selected over hundreds of thousands of years specifically for their ability to bond with humans, and the humans to bond with the dogs. Maybe cats not as much, but I'm a dog person anyway. But so whether it's a real dog that's keyed into your behavior and your brain, or whether it's one that could be basically programmed as an artificial dog or a bot, I don't know. I think the studies could be done, but my suspicion is that the same interactions might have the same kind of hormonal and the reward behavior in the brain. I think a lot of those things are still going to be triggered. Look, we didn't evolve to use typewriters, but we managed to do that despite that. And so I think a lot of the modern technologies are keyed into a lot of the same basic biological functions. So I'm totally happy with thinking that could work.
I think I would comment on the fact that a lot depends on what you get out of it, because the from what I gather, the social media has a big negative role in terms of the developmental age, children and adolescents, and the comfort of having friends, but being totally isolated on the other hand. So I think a lot depends on how connected you feel, because I take care of people in the nursing home, and interestingly, I'm finding them all with iPads and being able to FaceTime and connect with, outside world, because they're isolated in the institution. So I think there's definitely advantages, and it's how it's used that would determine, the benefits, as opposed to it being used to kind of drown yourself in just, media hours. Yeah. Mm-hmm.
This is great. And I now see there are some questions on the Q&A, not just the chat, and I'll get it to them, but on the dogs and the bonding and the artificial intelligence, just an anecdote. My mom has fairly significant dementia, and she's in a memory unit, and I was talking to her on FaceTime, and she's very tired and unresponsive. And the nurse said, let me go get her cat. She loves her cat. So she came over, and my mom came alive, totally came alive, was radiant. And the cat was on her lap, but then the nurse said, oh, by the way, it's a robotic cat. So, kind of interesting to me. She loved that, and they have robotic dog there, but they bond to it. They bond to it. Okay. So an anonymous attendee asked, what is a good way for a person in their 90s to develop self-motivation, to develop better habits and thinking patterns that will enhance healing?
So I think the question may relate to the fact that as we get older, we become a little more, a little less flexible in our habits, because our habits are formed over a period of time, and we get, accustomed and sometimes, limited by our habits and what we can do or can't do. So for someone who's in their 90s and they want to use, motivation to change or help themselves to heal, I would say start with one simple, small step, and just take baby steps towards whatever your goal is. For example, if you're looking at healing spiritually, take a step towards, okay, I'll do this tomorrow, I'll do this the next day. Kind of lay it out, as opposed to trying to get to the end right away, because you're not going to be successful that way. So I would say start small and go slow, and you will notice a change. And the change itself is very positive reward to your own healing by itself,
Now, when you said thinking is important and keep learning, how about brain games and all these puzzles and games that are supposed to enhance your cognition? Do you recommend any of that?
David, do you have any thoughts on that?
I love doing crossword puzzles, and I find that doing crossword puzzles makes me better at doing crossword puzzles.
Yeah, that's what I've heard. How about Wordle? Wordle, does that make you better at doing Wordle?
I'd say probably, I don't know if it transfers into other skills. I don't know. I think there are a lot of results in different studies on whether these so for example, there are ways to coach and train cognitive skills, and many of them do have benefits, but if you're training for cognitive skills, that's what you're after. So you want those things that are specifically like, but doing Sudoku is not exactly the same thing.
Yeah.
So I think it's important, if you're going to go with various kinds of training and coaching things, that you go for something that is really addressing what are those declines that you're trying to reverse, or at least, hold off for a bit. And so There are a lot of games you can get, there are apps you can get, but many of the studies show that a lot of those apps basically have no translation into other skills or cognitive benefits. They're just basically teaching you how to play those games. So it really does matter what kind of skills or training they're actually using.
That's interesting. Well, I would have thought, just thinking about it, yeah, I've read those studies. Let's say you've done a certain kind of work all your life, like I've done philosophy. Would it be helpful for me to find something that makes my brain work differently? Maybe a spatialization thing or something other than linear logical thinking?
Well, let's come into my lab and I'll have you do some experiments. Let's see what happens.
Okay.
But
Yeah.
so people will talk about things like things that have benefits. For example, learn a musical instrument that you may not have known, learn a new language. Those basically activate parts of your brain that may not have been as active. And
Good.
just by doing that, again, it will stimulate a lot of benefits.
Good.
Yeah, I think learning new skills, playing a new, instrument, as you said, trying to learn a new language, although it may be difficult and take longer, but you are able to do it. Yeah.
Yeah, good. I have another question from the Q&A. Do you have any tips for aging on how one hopes for the best but prepares for the worst, reduced functioning, death, and yet still remain optimistic?
Well, that's called life. You prepare for the worst, hope for the best, and maintain your sense of being and continue moving along. And I think it's a very good perspective and a balance that, in my opinion, elderly get to actually master that very well, in that they do not kind of just think about the worst outcome scenario down the line, but are enjoying the moment, being present and focusing on what they have as opposed to what they don't have. And I think that kind of is kind of drawing attention to the internal piece of your being, and kind of relating to the beauty of life, and how, and you may have encountered events or things in your life. One thing I do recommend for a lot of my patients, and they actually will do that, is just thinking back kind of with their friends and family and enjoying those moments that they have in their memory and kind of sharing those with others. That helps to maintain that sense of, doing, because they may not be doing those activities or functions anymore, but they still have them there to enjoy and kind of share with the friends and family or, others. So I think the important thing is the balance piece, to enjoy the present moment and still know, that there's finite time and you have to maximize what you want to enjoy in that time.
David, did you want to comment, or are you okay?
Yeah, no,
Yeah, that was
I agree.
an excellent idea. Being in the present moment, but remembering there won't be an indefinite number of present moments.
Well, and it goes to a little bit to what I was saying about using that perspective to say, how do we value those things, just as Dr. Jaffrey was saying, is like, we have grown to understand things in depth, and so how do we change our values to really recognize what we've done?
Yeah. There's I'm also reminded of the Stoic philosophy, the great Stoics like Seneca, Epictetus, Marcus Aurelius, and part of their idea was that you could pre-rehearse. You could think, what's the worst that could happen here, and you think about, and you realize it's not really so bad. And so if you train yourself to think ahead about what could happen, and realize that you'd still be okay. It still would be okay. At least that's one of their ideas. There's a book by Nancy Sherman, a philosophy professor at Georgetown, called Ancient Stoic Wisdom. I really recommend it. It's interesting. They had a whole theory of how to face our fears and anxieties about the future, but still in a realistic way, but still thrive. So that would be something you might find interesting. Another question, how does a geriatrician interact with physicians and an at-home care team?
Could you repeat the question, John?
How does a geriatrician, whoops, I just lost the question. How does a geriatrician interact with physicians and an at-home care team?
Oh, okay. I think with other physicians, it's basically being the connection piece with all the other physicians, because that's where, depending on the problem or the issues, there may be other physicians who are involved in the care. And the geriatrician's job is to make sure that all are connected in the communication, and there's no mishap that occurs, or communication is fluid, and that the central person, is getting the best care possible among all the physicians. And the care team, whether it's at home or near in the nursing home, or in an office setting or a hospital setting, is very critical in terms of the main thing. I would say, for us at least, is communication, and we're always looking out for the patient's best interest, physically, emotionally, others, and making sure that the others on the team are aware of some of the nuances that go on with that they may not be aware of, being a not part of the care team or preferred part of the care team. So I think the central piece we do is a lot of besides diagnosing and stuff, is connecting the care teams. Yeah.
Good. That sounds important. Another question, is society being changed by more older individuals who have no familial contacts, few commonalities with other persons? We know that our population is aging, but are they increasingly isolated, and is that really fundamentally changing our society? David?
Yeah, I was going to ask you that question. That's a tough one, because we have several countries. China, the same thing is happening, is that you have an increasing population of aging individuals, and with only one child, if any. So the family connections are lost as well. And in some ways, we're doing the experiment right now to find out what the impact is going to be. I mean, part of it, we see that isolation, as Dr. Jaffrey was saying, in terms of the way social media can have a very negative impact, especially on people who are already socially isolated. They'll get a gun, right? And bad things will happen, right? So we already see some of those kinds of negative society effects. The question is, like, are we already doing anything to address that? And I'm not sure we are.
Yeah, I would say in response to the question about, as a society, and taking and the aging population and people living longer, and having our birth rate actually declining relatively, so there's going to be more older after 2050, that are going to occupy a lot more resources, and there is going to be a societal-wise challenge between education and old age. Where do we spend, where do we spend more money on the police, whether or education, or take care of our elderly? So that becomes more of a societal issue. And I think currently there is discussion about Medicare and all the other aspects of funding some of the Social Security that may become an issue down the line, in terms of less people putting into the pot and more people drawing out of the pot. The other piece relating to this is that I find, even within our society, within the US society, there's cultural differences in how the elderly are looked at and or cared for by families and others. Now, when I started my practice geriatrics in the 90s, I do a lot of nursing home care. I would never see a non-white person in the nursing home. And now, because of the effects of whatever is happening, I see for an Asian, I would never see an Asian family there because they would be taken care of by their family members at home. However, the societal changes are occurring in terms of the job market, the females in the workforce. 95% of the workforce for caregiving is females. But if they are transferring over to the occupation side, with working, they are not going to be the one providing the caregiving. So I think the caregiving gap is going to accentuate, especially if you have smaller families, smaller extended families that can care for, people that when they reach the age where they need help. So I think I view that as more of a governmental societal study to look at what the future will hold, because we will need daycares, a lot more like childcare. We have daycares, elder cares, some tax benefits for people who are taking care of their older parents or relatives. So that to me is the biggest thing I see coming, like after 2050 on is going to be more challenges because of the shift of the populations. And we know that after age 85, no matter what, you're going to have some levels of decline in your function. So who's going to be caregiving for those? A long answer, but no good, fixes right now. Yeah.
That's a huge challenge, the caregiving problem. It can be very depressing for the caregiver. Here's a question. I'm throwing out different questions now. It is well known that as we get older, we can be manipulated and gullible and taken advantage of. Why is that? Is that a brain phenomenon or what?
Oh, you mean to be, the scams, they go out and just scam elderly for, telemarketers and all those reverse mortgages. We heard about all those. I think for elderly, the issue is that whatever the first impression is stays, and you're unable to, for the most part, come up with alternate models of why this person is behaving that way. So if you like someone or if someone talks nicely to you and you think they're friendly, that's going to be your impression no matter what after that first encounter occurs. So that is actually being studied, and they will not change their mind, as opposed to given with alternate plausible things that would be the case, And I notice myself, I'm very gullible, when my family members tell me, how did you do that? Why did you give out these? And I say, okay, I trusted that person. So I think trust goes a long way, but then they don't challenge their own trust, in someone else. And that it is a fact, with the elderly. That's why we have all these things happening. And we need to be, have either vigilant caregivers or providers around who are checking all your stuff, because before you know, I've had people just sign up all their property to others.
Yeah, I've seen that. But it's ironic, because as we get older, we get wiser, and you'd think we'd be wise to these frauds, these people are trying to swindle us. But apparently part of our critical faculty goes.
Yeah, that's one of the critical faculty skill. Yeah.
Yeah. There was an interesting question. We've kind of already addressed it, but it's an interesting question. Don't games like Wordle, Hurdle, I haven't heard of Hurdle, cryptograms, enhance your deductive reasoning as well as vocabulary and grammatical skills? It seems that way to me. Same answer, David?
Well, see, look, for example, I am really good at the New York Times crossword. I'm really lousy at the New Yorker crossword because the skills are different. I don't know why, but it can't translate that. So I'm not telling anybody to not do those games because not only are they fun, they actually do develop at least some skills for that specific task. So definitely, no, I'm not against it at all. And like I said, I love doing it myself. But so the question is, if you want to develop, say, reasoning and vocabulary and grammatic skills, then I would say, I loved reading Montaigne. So start writing your essays now, just like build up your own, collection of essays. I think that'd be even more of an interesting challenge.
We're almost done, but are there tests you can do? We're all worried, might we develop dementia? Might we develop Parkinson's? The different diseases in front of us. Are there tests? Would you recommend taking tests that predict these things, or are any of them any good or useful?
Well, there are tests. I mean, so Dr. Jaffrey, you want to?
Yeah, I think there are tests, and there's actually a lot of research going into it. At this point, the recommendation is not for everybody to get tested, because what happens is, because of the not having the adequate critical research to support testing, is the issue where you may test positive, but you may never get Alzheimer's. So we want to have the research defined for us which tests we're going to kind of be the test to do, so that you can do something about it and not just create anxiety and worried all your life where you're never going to end up getting Alzheimer's. So I would say not unless there's strong family history or you're actually having some memory issues.
Actually, there was a nun study done a long time ago on Alzheimer's, and when they did the scans and looked at the degree of amyloid deposition, it didn't correlate with whether they ended up having Alzheimer's. I mean, maintaining cognitive function and activity seemed, that's more important than any kind of like scan or other kind of thing. So so the cognitive tests are there, but it's not, unless you really have some need to find out. I would agree.
Okay, I've really been fascinated by this conversation. It's 10 after the hour, and I think we need to wrap it up. And my cats are making noises in the background. It seems like they're hungry. But I want to thank both of our guests, David Lowe and Ozma Joffrey. Really appreciate all your contributions. Thank you all for attending and for all your questions. Really appreciate it. This has been one of the great pleasures of my academic career to moderate these discussions, and I hope that we'll be doing another one in the fall, this time on conceptions of the afterlife in Hinduism, Buddhism, and Jainism, with three wonderful UCR professors of religious studies, and we hope to be doing it in Palm Desert. So I hope to see you there, and please take courses from the Osher Center and look into all the wonderful programming we do at UCR Palm Desert. Okay, thank you so much for coming.
Thank you.
Really appreciate it.